Good evening, everyone. Thank you so much for coming out. My name is Claudia McCoy. I'm the facilitator for this evening. And again, I welcome you. I also want to first start the evening by bringing out our two partners, our community partners that have done wonderful work in our community. So definitely thank you so much. First, we want to bring up a representative from Malvern Family Resource Center.
Thank you so much. Good evening, everyone. My name is Mohammed. I'm the Inclusion, Diversity, Equity, and Accessibility Manager at Malvern Family Resource Center. I'm delighted to see each and every one of you, and we sincerely appreciate your participation in around the race-based data collection strategy at here at Malvern Town Hall. It is great to see this community. And I would say this is a unique opportunity for all of us to lead our dialogue and to take the initiative in our conversations and choose how best to translate and implement the recommendations from the collected data and convert it into effective practices in order to foster equity in our community. So on behalf of Malvern Family Resource Center Executive Director, Josh Berman, and on behalf of Malvern Family Resource Center staff, I would like to thank the TPS for bringing us together to talk about these important issues. Issues are impacting all of us, including the members that we currently serve. We're happy to be part of this partnership, to be part of this collaboration, and also to contribute to these difficult and heavy conversations that we believe will take us to a better place. Malvern Family Resource Center is a nonprofit social service agency that is committed to strengthening families and residents through inclusive and effective programs and services in Northeast Scarborough. Our center is located in one of the most diverse communities in the GTA, with an 85% visible minority population. In operation for almost 40 years, Malvern Family Resource Center has developed an extensive range of high-quality programs and services, meeting the specific needs of parents and children, youth and seniors, newcomers and refugees, residents and families. And our main objective is to be a source for significant and positive change in the lives of the people of Malvern through access to and knowledge of services which will help them thrive. We show our support for change by building community cohesion and solidarity, and will deliver programs and services as a vehicle to break down the injustice and the systemic racism that are endemic globally. Finally, I would say Malvern Family Resource Center, committed to its values of respect, inclusion, diversity, which are inherent in our day-to-day work and at all levels of our programs and services. We believe systemic racism is disparaging and hurtful reality for many of our families and residents, and we will therefore continue to ensure a safe and inclusive environment is embedded within our community. Thank you, everyone, and I'm going to turn it over to our great facilitator, our great speakers, and we are looking forward to a productive and collaborative discussions and conversations. Thank you so much.
Thank you so much for your service. I also want to bring up a representative from Taibu, Community Health Center. Please take the floor. Thank you so much.
Good evening. Welcome to Malvern. For some of you are here for the first time. We're happy you're here. Thank you. So My name is Estella. I'm a health promoter at Taibu Community Health Center. It's so amazing to see so many of you out this evening, all for one good reason. Again, welcome. So, Taibu, who we are. So Taibu is a Swahili word meaning be in good health. So where systemic racism prevents marginalized population from accessing necessary health care, community health centers are designed to meet the needs of marginalized population. So Taibu Community Health Center offers Black identifying clients from throughout the Greater Toronto area access to primary health care and health promotion and disease prevention program in a culturally affirming environment. So, our model of care. Taibu believes our goals: prevention in ill health, restore health and wellness, advancing community care and well-being. Our principles: intersecting anti-racism, anti-oppression, and culturally relevant practices. Quality, the highest quality people and community health care. Our practices. We focus on a strong focus on determinants of health. We collaborate interprofessional, integrated, and lots of collaborative with our community partners. We provide accessibility, providing appropriate access to everyone in the community. We are community centeredness and community governance. So, Taibu Community Health Center, we provide health services, community programs, and some of our programs, the Francophone services, older adults programs, social groups, physical activities, chronic disease, self-management. We also have a Black Health and Black Men's Health Challenge program, physical exercise that is open to everyone in the community, daily, evening, every day, Mondays to Fridays. Easy access for all members of the community. We have care for families and seniors, and the Toronto Community Crisis Services as well. Youth projects. We have from School to Success Pipeline. We have Learn, academic and literacy program for younger children. And we also have the Plug program, which supports students. We advocate on behalf of students to resolve issues, advocate via legal counsel, intervene as necessary to avoid suspension and overturn expulsions. The Toronto Community Crisis Service, we service the northeast section of the GTA. So the Toronto Community Crisis Service team has non-police-led mobile crisis team that can meet you 24 hours a day, 7 days a week. We are here to provide immediate support. You call us. We meet you at your home or any safe location in our service area. All you gotta do, call 211 for help. So, finally, I would just like to say, just having an understanding of historical trauma, including genocide, imprisonment, enslavement, and exploitation, can help us build healthier, more compassionate community. Thank you so much for being here. We love you all. Take care.
Thank you. Bev, do you get that all done every day? That's incredible work that you do on an ongoing basis. I was thinking you invented the 100-hour day, but thank you again. Incredible. Again, my name is Claudia McCoy. I am the facilitator. This is the second one that we've done. A third. We've done 2. This is the third that we're getting to right now. I am the founder and principal of a firm, a consultancy firm. And what we do is we close connectivity gaps for organizations, right, with their community stakeholders. The first 2, we recognized that there were narratives around meaning around the concept of data versus meaning. And we also saw that there was gaps between the agency and the community wanted desperately to close that gap, and the agency wants to close that gap as well. The second, at the JCA, we saw the extension of that narrative, and wanting to have police officers do the beat that they knew over a long period of time, that they build relationships with. So we started to see the pattern consistently of how can we use data and work together to actually have a mutually beneficial relationship. So tonight, hopefully, and from the conversations that I've had with a few of you as walking through, there is a need and a want to have safe, healthier relationship with the agency and the communities. So in that framework is where we're going to have our conversation today. There's a couple of house-cleaning things that we need to do. For those of you who are new into the space, there are 2 bathrooms right outside. There is food. Food always wins, and water. And there are 2 microphones. The microphone over here gets you on camera. Some of you, like me, believe it or not, is shy from cameras. And they dragged me up here today. And if you are, there is a microphone over at the back where you won't be on camera. There is an online component where there are community members that are actually going to be engaging with the process online. And there is also going to be what I call a breakout session, a World Cafe, so that you can engage with some of the operational stakeholders as well, to get a sense of the idea of what's going on, the recommendations, and your insights in how the agency can actually move forward and create better relationships. With that being said, no relationship is done if we're not respectful from the beginning. So, right? So we need respectful conversations, at least here, and we can actually respectfully say, hey, these are the areas that I think we, as a community member, need more respect and more support. So with that being said, first of all, I want to actually thank you again for coming out and doing this work and partnering with the organization. On the topic of race-based data collection, we have 4 people, but I'm going to start with the CIO, Colin Stairs, and have you take the floor and make some comments.
Are we just doing the introductions?
Just introductions.
Okay, so hi everyone. My name's Colin. I'm the Chief Information Officer / Deputy Chief for Information and Technology. So what does that mean? It means that I'm one step below the chief. I'm his ears here. I'm here to listen, and I'm here to take whatever's said in this room back to the command, which is the group that leads the organization, and if necessary, to the board. So I'm absolutely here to listen, but also a big part of my job is about affecting change in the organization, and my background is mostly about using technology to affect change, to make things different. So you see the 2 gentlemen in the front here are wearing body-worn cameras. Bringing that to life has been one of the projects, and the positive impacts that's had on accountability, on comfort people have had approaching officers. That's something that we've been able to do, and there's lots of other work that I'm not here to tell you about that we're doing to try and move the organization to try and make it more accountable, more transparent, more efficient. And all of that is on my broad shoulders. So again, that's enough from me. I'll pass it over to Mai, and I'm looking forward to hearing what you have to say.
Hi everyone. My name is Mai Fan. I am the equity data scientist. I've worked with the Toronto Police Service to bring the race and identity-based data collection strategy to you, to report on the findings, to show how we can use data to really improve policing and improve how communities experience policing so that it's more fair, it's more professional, and it meets community needs. I'm here to represent the team as well, who are scattered around in the audience. They are here who been committing about 3 years of really hard work, and it's going to be ongoing hard work as we continue to roll out this strategy and continue on this path of evidence-based approach to really understanding policing impacts on communities and working together to improve how we do things and how we can improve community safety for everyone.
Hello, everyone. Good evening. My name is Greg Watts. I work at 42 Division. I'm the superintendent there. I'm thrilled that this is happening in Scarborough. I'm thrilled that it's happening in Malvern specifically. I also want to thank everyone for coming out here tonight to have some meaningful conversation. I will say, though, that even though Mike and I are sitting up here, the work that takes place out in the community happens with the officers that are here tonight. So I want to give them a quick shout out. We've got Ryan Ford in the back. He's our staff sergeant in charge of all of our neighborhood policing. We've got Jack Crilly in the back. He's our detective sergeant. He runs all of our criminal investigations and stuff. Then we've got our neighborhood officers here. We've got Neil Hall, one of our neighborhood sergeants. We've got Jeff Ems, one of our neighborhood officers. We've got Richard Shaw, our other neighborhood sergeant. And where's Ramesh? I saw him. Where's Ramesh?
He was taking pictures.
He knew I was going to call him out. That's right. He was like, I'm out. We got Ramesh Prasad, a.k.a. Ace. He's here tonight. He's one of our neighborhood officers as well. So looking forward to chatting with everybody, and I'll turn it over to Mikey.
Yeah, thanks, Superintendent. I'm Mike Williams. I'm the inspector at 42 Division, and that's second in command to the superintendent here. And what does that mean? I'm in charge of what's called the day-to-day operations. One of the things I do is review in a morning meeting every day the things that took place the day before and look for sustainable solutions or more positive outcomes and look for opportunities to make referrals or to ensure that our officers are focusing on things like some of the great folks you just met that can provide more sustainable solutions for people and hopefully prevent them from coming into contact with our officers and what might be a negative interaction. So that's part of what I do, and it's great to see so many people out here to hopefully give us some feedback and help us improve and and make Malvern and Scarborough a better and safer place.
Good evening, everybody. My name is Nate Wilson-Taylor. For those of you that do know me, I actually work next door. I am the youth program coordinator. So nice to meet everybody. Also, I do sit on the community advisory panel with the Toronto Police Service. I'm one of the 12 community members, and keyword community that is actually helping to help drive the change. So looking forward to a very, very meaningful and also respectful discussion. And I'll be around in the back if you have any questions or anything, and I'll pass it back to our facilitator there.
Thank you. We're here for, as I said before, around race-based data collection. And it's important that we actually, as we are listening, Colin said he was only going to be listening, but he has a lot of information that he has to depart first. When we listen to the presentation about race-based data, we need to be listening to what impact, what does that mean to us, what our feelings are around these issues, and communicate them so that the organization can actually hear what race-based data collection means to you, and what are some concerns or even hopes around race-based data collection. Colin, the floor is yours.
Okay, thanks. So I think we need to start this conversation in recognition and acknowledgement that the community's been pushing the Toronto Police Service for decades towards reforms, but also towards measurement and being transparent about racial disparities, different outcomes for different people. The chief's apology that he made in June was about not living up to that standard, not doing the measurement that was required, not taking the actions that the community was pushing us to do, and I will say particularly the Black community and activism in the Black community. The first thing I want you to understand is the level of commitment that we have towards looking at the problems and making changes. There's the 81 recommendations for police reform that we've been working on for the past 2 years. There has been this race-based data analysis, which, believe it or not, is in its 3rd year of work. So we are starting to see the fruits of some of that effort and that commitment, but that commitment is going to continue. Where I'd like to be is that we don't need to be pushed by the community, but that we, under our own initiative and our own steam, are looking at reforms and addressing the changes that, that need to take place until we get to full equity. What does that look like, and why are we here having this conversation? We want you to feel safe and be safe, both in your relationship with the police, but also in the community. Making you safe in the community, making you feel safe is the objective. That's what we want to do for you. That's what the mission of the organization is. And that's what all of this, in some way, shape, or form, centers around. We can't solve these problems with data alone. The CAP members, we took a different approach to the methodology on this. We didn't say, hey, here's the data, what does it tell us? We said, here's the data, what questions does this bring to mind? And we asked our community advisory panel, 12 people from different parts of the city and different community, to ask the questions that they wanted to put to us. And then we tried to answer as many of them as we could. And some of those questions had really obvious and not very interesting answers. And some of those questions really sparked some interesting, challenging conversations that we tried to have in the CAP. And that we'll probably have here in this room. I hope we will. But we also had something like 60 questions that we couldn't answer because we didn't have the data or the data measurement or the data collection that we needed to be able to do it. Now, I'm a nerd. I'm a geek. I like data. That's my clan, techie guys who measure everything and do digital. But we recognize that with the measurement quality that we have, we're only going to be able to make it so far. And we acknowledge that we need to go further on faith and make changes on faith because we've had the conversation and we think it's the right thing to do. And it might not necessarily be supported by the data. Okay, so part of the conversation today is what does the data say and what does that mean we ought to do? So all the data and the action plans and how those should change. And part of this is about what else do we need to do just because we believe we need to do it. And I hope we can engage in that conversation. Also acknowledge that some of this is going to dredge up some pain for those in the room. I think the first part is to acknowledge that that's probably going to be the case, and to thank you for being courageous and coming out to have this conversation despite that. And hopefully we can build a courageous and engaged conversation that's going to lead to, I'd say, more change and an acceleration of change. So we're committed. We want to make you feel and be safe in the community and with us. We want to get to work sharing and building, co-building, co-designing what the future looks like. Thank you.
Is this going to be a presentation?
Oh, I got a hand off. Sorry, bad segue.
I'll just take it away now.
You just take it away. Okay. Just
Thank you,
claim the mic.
Thank you. Thank you. And like Colin said, we didn't do this alone. This effort has been the result of decades of leadership from communities, activism from communities, particularly Indigenous, Black communities who have called for us to do better. We can't understand a problem until we, have the means to measure it, to really look at it in a careful way, so that we can have targeted solutions, right? And so along the way, that is reflected in how we did the strategy as well. It started with a provincial Anti-Racism Act, which compelled public sector organizations, including policing, but also corrections, also bail courts, right? We all have a role to play, including school boards, children's aid societies, to collect race-based data and really understand what are the differences in outcomes that different communities are experiencing in these systems. So we started there. The board introduced a policy to really drive the service to make these efforts in a particular way. And so since 2019, we started engaging right away. We had a series of town halls. You can see some of these white spots, dots there on the graph, on the chart above me. Those points in time where we engage with different organizations, agencies, committees in the service, as well as our own frontline members and uniformed members, because we needed to understand their experiences and the operational realities that they work under as well. So the efforts of the race and identity-based data collection strategy really stands on the leadership and perspectives and the lived experiences of people. So one of the things that we heard from the community advisory panel is that we needed to really map out what policing looks like, right? We can't have these really, deep conversations with communities without knowing what it is that we're talking about, right? So one of the things that in our conversations, it became really clear that there is this simplistic, simple idea of what policing looks like, and it looks like this, right? Office 911 call comes in, officer arrives on the scene, it leads to an arrest, and the person can be released on scene, or they can go to court and be arrested and go through the court process. But in reality, when we started talking to our frontline members and talking to people who have actually been engaged in the policing process, it was a lot more complex than that. There's a lot of ways that police can come into the situation, right? It's not just a 911 call. It could be a call from the school board, right? It could be a call from, it could be an interaction, on the street where officers, walking around and a community member approaches them. So the points of entry into officer-involved interaction is numerous, right? And then the ramps to come on into the criminal justice system or to go off of it there's a lot of different ways that people can go through this process. It doesn't always lead to an arrest, right? Sometimes it's a referral to a community agency like Taibu, right? It could be a mental health apprehension where the person is led to a hospital for treatment and help. But the person could end up arrested, right? And go through the booking process. And so by mapping this out, we could really have a informed conversation and identify where are the points of pain, that is happening. Where are the areas we need to look at to understand some of the issues that community is bringing to us. And so for phase one of the race-based data collection strategy, we started small, right? We wanted to really test this approach of data collection to understand systemic racism, systemic impacts on different communities. We started with use of force and strip searches. Those were the two areas that community leaders and through various official reports have really identified as priority areas of concern, right? And so if you skip a slide there, you can see, go back. You can see the points of the interactions in that complex map where a decision to use force could happen, right? Those are the highlighted dots there. And also where a strip search could happen near the end of this line. So we focused on those points for the first phase. And that is what we reported on in June, the findings from that analysis. So I'll take you through some of the key main findings in use of force, just so you can understand what we're talking about and why we're here today to come up with some solutions. So what do we mean by a use of force? Where are we collecting in use of force incidents? What is that? In January 2020, the province compelled all police services to collect race in use of force reports. And it's limited to very specific kinds of situations, right? It's not every use of force. It's a provincially required use of force report where an officer uses physical force. So it could be a punch, a strike, right? That results in medical attention. So the ambulance comes to the scene, nurse or doctor has to treat the person. It could be any incident where an officer uses a firearm or a taser, right? So it's either drawing it out of their holster or pointing it or shooting it, regardless of the level of injury. And also whenever an officer uses a baton, a pepper spray, a police service dog, or a police horse. So any one of those types of incidents, an officer has to submit and fill out a form and submit it to their supervisor who checks it, right? It's sent to the college who enters it and maintains a record in order to identify whether, a particular officer needs further training or not. And it also is sent to the ministry. And so that's what we're talking about when we say use of force. So it doesn't involve situations where an officer, has to handle, a person in order to put a handcuff on, right? That is physical force. It is, it is a use of force, but it is not a reportable use of force according to the provincial definition. So what did we find when we looked at use of force incidents? We wanted to understand use of force as part of a pathway, right? We wanted to understand if there were over-representation of certain people in having a police interaction, because you have to have an interaction with the police in the first place in order to have a use of force, potentially as a result of that. And then once a person has an interaction with an officer, are they more or less likely to experience a use of force based on race? Right? That was the main question we had. And so what we found was that there were certain patterns, right, involving different race groups. We identified 4 different patterns. One distinct pattern of concern were incidents involving Black people and Middle Eastern people. For those groups, they were more likely to have a police interaction relative to their presence in the city. And when they do have an interaction with police, they were also more likely to have a use of force, right? So they were overrepresented in both instances. For Indigenous people, it was a distinct pattern. They were more likely to have an interaction with police. That was an enforcement type of interaction. But when they do have an interaction, they were less likely to experience the use of force. And so that pattern tells us that we need to look at what's happening upstream, what is leading officers to the scene in situations involving Indigenous people, and find other ways to help that group that maybe doesn't involve policing. For other groups like Latino and East, Southeast Asian people, we found that they were less likely to have interaction with police relative to their presence in the city. But when they do, they were more likely to have a use of force applied. And so for those groups, including Black and Middle Eastern people, we need to understand what is happening when officers come to the scene. Why are decisions to use force more common in those situations, right? And so this approach, and you can see in the next graph, that illustrates how the overproportion of Black people in use of force, the thicker line on the left there compared to the thinner line on the right for Black people, why is there that overrepresentation happening? So we also dug deeper into those situations, right? We wanted to understand what were the types of situations involved, right? And that chart next to Inspector Williams there shows you all the red squares, right? All the red squares show us where there's an overrepresentation and use of force in certain types of situations. So what we see is that for incidents involving Black people in mental health related incidents, there was use of force was more likely, as well as in violent calls for service. So we really drilled down in the data, and we identified specific situations where we needed to understand better what was happening and why use of force was being used in those situations involving certain groups, but not others. Right? And so the data really helps us to get closer to understanding the problem on a systemic level, and it helps us to have better conversations and more focused conversations on what some of the solutions might be. For strip searches, we also looked at strip searches, as I mentioned, and we compared the trends for strip searches over time because we wanted to see if policy and procedure change made a difference. In October 2020, the service really took a look at how we were conducting strip searches in arrests situations. And we improved training, we improved procedures. And what you can see from this graph here is how there is a dramatic drop in strip searches after the procedure change. And the drop in strip search was not just, we did fewer strip searches, but the differences by race group also changed. Prior to the policy change, we saw an overrepresentation of Black people and white people in being strip searched compared to their proportion among those arrests. But even more so, we saw Indigenous people were 30% more likely to be strip searched when they were arrested. After the policy change, that difference disappeared. And so what this data tells us in terms of the strip search situation is that policy and procedure change really did make a difference. Improvements to training really changed the picture, and we will continue to track and monitor strip searches to make sure that those positive outcomes continue to be seen. And how can we replicate that in other areas of policing interactions as well. And so that's what we want to hear from you today, focusing on particularly use of force and some of the actions that we are proposing to take to address the racial disparities, the differences by race that we are seeing in use of force situations. So I'll pass it to Colin.
Okay, so we said we were going to listen, and then we did a lot of talking. I promise we're just about at the point, and this is where I really would like interruptions, any questions that you want. Mics are there and there, because the discussion, and we kind of got into a catch-22 around this. We wanted to take this data that we've had so much great learning from and put it into immediate action and make a bunch of changes, but there was a very strong understanding that we couldn't do that without the community being part of the conversation around what actions to take and how those would be structured. So we took a swing at it, which is on this card over here, talking about the changes and the different categories of changes that we thought could have effect. But we recognize that that's both imperfect and incomplete. And so the conversation is really, okay, so if we're finding this, this is what we're doing about it, and what do you think? So this is the time to have the challenge and have your voice heard. I'm going to do this in part by walking around some of the results, and so why we thought what we thought and why we're going, right? So the first and foremost was listening and understanding. So that's what we're doing, or we want to be doing here. I think the two town halls that we've had previously, we're getting better at understanding, reflecting on, and integrating some of the thoughts of the community. But we are also changing the way we do that because we're getting feedback on how this could go better and how those conversations could go better. In terms of governance, a lot of the questions revolved around how are we holding officers accountable for their actions. You may recall around June, there was a lot of calls for, why don't we use this race-based data to identify the officers who are doing racist things and get them out of the service. So that was a real conversation. And part of the answer to that was, if an officer is involved in 3 uses of force, there's an automatic review of those actions and what they've done. And we don't think that in 3 data points we can figure out whether something they did from the data we have was racist or not. So that's the problem. So we're looking at tightening the screws on the governance and the oversight, and that takes 2 forms. One, there's going to be a strengthening of the strip search committee. So we achieved some really good change with strip search, but we've got to make sure that it goes even further and we don't backslide on that. And we're going to form a use of force committee at the superintendent level to review all the questionable uses of force in the service and look at it from a policy as well as a discipline lens. Okay, so that's a new governance. The other thing we're looking at is when we do a project, and by a project it might be like a big drug operation or trying to get guns, trying to find a gun dealer and take them off the streets. When we're doing those kind of projects, we want to build in an equity dimension to the project. So I'll give you an example of the changes we've made in the last, I think, 5 years. It used to be that we'd do a big project, we'd decide who all the people we wanted to go get were, and then we'd kind of invade a neighborhood, take everybody down in one day in their homes, 3 a.m. Kind of takedown, and then that would be very traumatic to the community. So the community said, we don't like that, we want you to stop. So the change in procedure is, as the investigation is going on, we're arresting people one at a time away from the community as we go. That's a huge change in operations and how we do things, but it's because what we were doing was traumatic and awful, not just for the criminals who we needed to arrest, but for the community and the families that were around them. So that would be an example of an equity assessment of what are we doing and how is it impacting around the governance. In terms of communication, and again, jump to the mic and challenge me. Or save your powder and ask questions later. But in terms of communication, a lot of challenges around what's this data actually say, and why are you guys holding it and keeping it away from us? We want this data. We want to be able to look at it ourselves, and also a lot of questions about the trust in the data. So how do we know the cops aren't like writing this person's white when they're really black? That was a question that came up a lot. So we're putting all the data, we have put the data on the website. It's open data, and it's all in the raw on our website. We've done some analysis which pretty sophisticated, so not everybody's going to be able to do that. And so we also want to have open analysis, and we want to have these kinds of conversations where we can explain in plain terms what we're finding. Okay, so that's about the communication and the transparency on this. There's a lot of training changes as well. There's a body of work around revising officer training, and that's ongoing at the college, and that's including anti-racism in the training that creates an officer out of a man on the street or a woman on the street. We're also looking at something called adverse childhood events training. So ACE, or adverse childhood events, are events that traumatize children, and traumatized children grow up to be traumatized adults, and that affects them in terms of addiction, suicide, criminality, all sorts of challenges and issues. So we want to look at training our officers on ACE in order that they can reflect on the pain that they have, that they may then bring into the world as officers, and also that they build more empathy towards the people that they're serving and the challenges those folks have. Yeah, question? Sorry, that will always be me, just so we know. We've got... No, I'm good. Okay. So the question is, are we training officers to recognize a child?
Can look to some like an adult, and that's part of the problem. So how is that part of the training? Again, sorry.
No, it's a good question. It's a great question. It's not part of ACE. It's not. So I think, did I repeat the question enough so that people at home can get it?
Yes, so just to let you know, I didn't want to stop the flow right there, but the reason why we have the microphones is so that people can hear you online as well. I didn't make that really clear, but yes, please take the floor.
All right. So my name is Jennifer Robinson, and I've lived in this community since 1986. My question to you is, and this is really hard, are officers being trained to recognize a 12-year-old child is not an adult, even if it's a 6-foot 12-year-old child? I'm asking that question because that's what's happening to some of our young boys. So I'm sorry.
No?
So, fair question. We have someone from the college. We have a couple folks from the college that may be better positioned to answer that question. No? I'm putting you guys on the spot. I don't know where you are in the room. In terms of training people to recognize children, even though they may have developed to the point where they look like a 6'6" man.
Night, everyone. So I would probably reframe that a little bit. I think maybe part of the problem could be legitimately that they do look like a child, but if they, you know, how you treat somebody, whether they're a child or an adult, is important. So I don't necessarily think it's the officers don't know that they're children or they're a child. It's the treatment or the attitude that is brought to the individual who's being treated. So I would probably just reframe that a little bit, because I'm not convinced that it's because the officers don't know they're not a child.
So I'll just say that this isn't something that we've looked at in the race-based data, but it could be something that we look at in further rounds of so this is all based on officer perception, right? So the race-based data is based on officer perception because the officer's perception would be what might drive a bias. So then the question is, well, what about the officer's perception of the age or competency of an individual would also be at?
Well, my son is old now, but at 13, he was already 6 foot tall. So, you know, somebody looking at him might think this is an adult. So that is an important piece. I'm not saying that it's necessarily a specific police that has done that, but there have been times where a young child has been mistaken for someone older. From the back, maybe, or just because of their height. So
I think you're touching on another point, and I think it bridges.
So sorry, thank you.
No. I actually don't want you to go. I think it actually bridges, and I want to see if this is along the nuance. And the gentleman at the back, that made you, yes, yeah, the one who's looking around. You do make a very good point, and I think there's an overlap here. It's not just simply whether or not the officer recognizes if the youth is a youth, is if officers, and we talk about this in our community and we don't really say it out loud, whether or not the officers recognize our children's childhood. I think that's a very, very distinct narrative, whether when they see us, they actually see what they would see in other children, or do they see our children not really as children and treat them slightly differently. And this is where I think some of the narratives have come up around, you know, I know in Peel there was discussions about, you know, how children in schools were actually treated. And I think for this narrative around race-based data then, and Colin, I think you were talking about is, thank you, is we see the perceived concept of race, but we don't see the perceived concept of age and all of these elements that make up the human or what is being perceived at the time. Are there going to be further, more nuanced capturing of data?
Yeah, so the whole part of this is it's a cycle, right? As Maya said, we started with what we started. I'm not sure it was starting small, it was a lot of work. But The idea is this is a continuous improvement cycle, and part of what we study next is what you ask us to study next. And so heard and understood this intersectionality of age, childhood, and race is important. I think we've also talked about gender and gender issues. So there's a bunch of different intersectionalities that are happening. I think, as Mai was saying, there's definitely an issue in the intersectionality of race and mental health. And so we're on that one, and we think we need to study that one a lot harder. So if you don't mind, I'm going to continue, but please challenge. This is great. This is a good conversation. So the other thing that we're changing in the training domain is coach officers. So the coach officer is the senior officer who takes the junior officer under their wing and shows them the ropes and how to be a cop. And that's the partnership they experience. I think it's the first 6 months that an officer's on the service. The coach officer was what it was, but it wasn't anti-racist. It was just the coach officer program. And so what we're doing is we're revising it to become more community-centric and more oriented towards community needs, being trauma-informed, and make it a more positive force in terms of changing the service. So that's the revision of the coach officer program, and that's already underway. We're also changing just some of the procedures, and a lot of policing is governed by procedure. There's a procedure for pretty much everything. So the procedure around use of force is changing in that if you're a new officer, every single use of force is going to get not only reviewed, but there's going to be a sit-down debrief with your boss about what you did, and not only was it justified, but was it necessary, in that conversation. In addition, if you're an experienced officer, all a body-worn camera, an in-car camera is going to be reviewed for all interactions, for all use of force interactions. So that's bringing up the level of scrutiny that's happening on that. Yep. Can you go to the mic?
Can you go to the mic?
You don't want to go to the mic. Okay, I'll repeat your question. So no, I'm not saying that it wouldn't be or could be considered racist or it couldn't be racist. I'm saying using just that data, it's hard to say that it would be. So let's say there were 3 uses of force in a row and they were all uses of force against a black person. Does that mean that that officer is racist? Well, what if they are policing a majority black neighborhood? Then that would make sense. That when they're policing, they're interacting mostly with black people. So the math isn't sufficient. What we can do, though, is we can say, we should really look at the body-worn camera of those interactions. Ooh, that looked bad. Or, no, that was fine. And then we have the conversation, and if discipline's necessary, or if coaching's necessary, if retraining is necessary, or if it's so egregious that this is tribunal and this is moving them off the service. So that's how we're trying to tackle the discipline issue. Okay.
And sir, I can from the 42 experience, from 42 Division here in Malvern, what we do internally is every use of force instance is reviewed heavily, right? So it not only gets reviewed by immediate supervisors, 2 of them. It then goes up to to a detective who's our unit complaint coordinator. That individual does a deep dive, reviews body cam footage, does in-car camera footage, memo book notes, everything. It then goes up to Mike. Mike does the same thing. Then it comes to me. I do the same thing. And I can say that there has been instances where we've looked at a use of force that we have done discipline. We have enacted the discipline process, right? So there is a lot of layers that it goes through. And then when it leaves us locally division, it then goes down to the use of force section at our training college, and they do the same thing.
So there's also, like I was talking about the governance and strengthening the governance, that use of force incident that gets reviewed by the superintendent would then go to that group. And they'd be like, okay, so this happened in 42. What about the other divisions? Is this the same thing? Do we have a procedural problem? Do we have to change the way we're doing things? Another question.
Sorry, this is more of an encouragement than a question. We are live streaming on YouTube, and so if participants who are viewing it on YouTube would like to ask questions, they can place their questions in the chat, and then we'll actually read them out live.
So in terms of the monitoring, officers get scorecards. They get report cards, and that's called an officer performance report. Right now, the officer performance report has a lot of things like arrests, number of tickets that are issued, kind of those types of operational activities around enforcement. And we think that ought to be reviewed. It's something that we want to review with the community, but we want to build in more community measures. So how many referrals did you make to community agencies? That kind of metric in order to build in the incentives for officers to behave the way the community wants the officers to behave. So there's absolutely enforcement, and for the most part, community wants safe streets, so enforcement is part of it and will always be part of it, but also support and service. So that's a conversation we want to have. We recognize you can't do that just entirely inside the service, and we're going to be launching that shortly. The other thing that we've heard is that oftentimes people have seen something they don't like, but are reticent to make a complaint because they're concerned that it'll have a comeback on them in the community or with those officers. And I like to say we have a lot of hammers, we don't have a lot of screwdrivers. Okay, so we have SIU, we have OIPRD, we have PRS, which is the internal investigation capability, and all of those things kind of result in whack, a hammer. So what we need to have is more community-informed screwdrivers. There's sort of two things we're playing with, and I'd love to hear your feedback on this. One is community members reviewing body-worn camera. And maybe not, and this is something the chief himself has put forward, Chief Raymer. This is an idea of, okay, how do we choose the body-worn camera that might be viewed by, select maybe trained members of the community that want to be part of that. I will warn you, we're generating about 1,000 hours of video every hour. So there's a lot of video out there to review. It's unmanageable amount of video that we need to review. So picking which videos to review is really the art in that one. But that's a conversation we want to have. The other thing, the other screwdriver is doing post-interaction surveys. So I'm sure you've had a survey from a hotel or a restaurant that says, how did we do? And you get a little email. And you say from 0 to 10, and maybe you get a second question that says, what was driving your answer? What drove your answer? We'd like to do something similar. And that would probably cover not just the officer you interacted with, but with the 911 caller who handled the call and the whole stem to stern. And it would be a gentle pushback. So you wouldn't have to fear, well, I'm going to see that officer again, and that's going to have a comeback on me. But it's a way for me to give a little bit of a nudge in the right direction. And if we start seeing officers who have really negative scores, then we can have a conversation, we can look at their body-worn camera, and as managers, we can engage on trying to train that person better or manage them better. So those are what we came up with in terms of ideas and why we came up with them. I'd say one that's not on the list is one that Mai pointed out. The mental health discrepancy around those, the difference in outcomes for those who are in mental health person in crisis calls are much worse in terms of disparity of use of force than they are for other types of calls, particularly things that you might think would have a lot of use of force. So we need to look at that hard and understand where that's diverging. I've had some really great sidebar conversations with some folks at these town halls around that, and it's starting to get some wheels moving around the MCIT teams, that's the mobile crisis intervention teams, and some of the folks who specialize in that interface with mental health within our organization. So I think that's, I've now spoken more than enough, but I'd like to get your questions.
Just asking a question that's from online, and it's regard to procedure, workflow, and monitoring action items. Is race-based data being collected on arresting officers, and are there any trends of non-Black officers arresting visible minorities?
Yeah, that's a great question, and we've heard those, those hypotheses in our engagements with both members of communities in the Community Advisory Panel. Thank you, Nate, for representing. It's even nodding his head. And also from our own members, right? They wanted to know if there were patterns and trends in terms of like rank, years of experience, right? And so what are some of the things that, that can help us understand this better and help us to improve the way we train and the way we approach situations? So we are looking to see how we can start to answer some of these questions and look a little bit more deeply. There's a lot of interest, including from the board, to look at individual officer trends. And so, as Colin mentioned, it is very tricky mathematically to try to identify a systemic pattern when you have very few data points, right? And so we need to look at other kinds of information that might help us to identify officers who may not be doing as well as they could be or should be in terms of fairly treating people. But that doesn't mean that we can't also look a little bit more drill down level, like for example, division level or neighborhood level at some of the trends, and to see some of the local, dynamics that might be happening that could explain some of the disparities, and also where we can take targeted solutions and work with local communities on what specific issues might be going on in the neighborhood, so that we can address, whatever it is that the data is pointing us to. But I think, like Colin said, data is not going to answer all our questions. It's these kinds of conversations and really understanding the on-the-ground experiences of people, talking to our officers who work in these areas to really understand what's happening and getting a clear picture of issues.
Hello, good evening. I wanted to ask, what actions are being taken toward restorative justice and reparations, seeing that all of this actually does come out of the greatest crimes against humanity?
Just clarification around that. And I believe we met last time in the JCA, so welcome back. Are you saying actually reparations in the classic sense of the word, like giving the communities some types of resources, or I just want to be very clear that I understand your question.
Well, yeah, definitely. Reparations and restorative justice, right? Because the issue is so broad that the solution has to be broad. Or if you want to simplify it, our people were denationalized. We're seeing what's going on in the Ukraine right now and the big issue about that. Our people were denationalized, and all of this power disparity is coming and based out of our denationalization, and that our identities to tomorrow have been stolen and kept from us, from the majority of us.
So the question and actually statement, because there's both a question and a statement that you're making. And I think that the agencies that we have in the country across are reflective of a history and have a time and place within history. And one agency alone is not going to address or even have the authority to address all of what you're actually referring to. The question about how the agency itself, and then I'm going to let you guys speak about the agency because I'm not from the agency, but the agency itself trying to repair damages based on what is perceived at this point around racism, sexism, go all the way down the list, I think is why we're here today. Am I mistaken? Right? Is to actually find out from the community how the organization is going to better work with the community to resolve these connectivity gaps and these equity gaps. And so I think that's a good question for either you two to speak, or actually anyone on the panel to speak. How do you see the race-based data narrative actually addressing equity issues? And I will also add, sorry, I just wanted to make sure that they have opportunity to respond.
But
And-
that's not the question I was asking
Well,
at all. That totally
Okay,
went
sorry.
left when I was somewhere else.
Okay, so
you,
I'm
yeah, you totally
my-
misunderstood my point.
Okay, so what is the point? Sorry,
So
I'm
the
missing.
point, and this is the understanding, I mentioned that there's different disparities.
Mm-hmm.
We do understand, it's common sense. So if I had put it on the simple, right, when I said denationalization, we had nations, we know how nations operate. So we are aware this one independent body, because that's a game that's played, use this body and make an example out of them. The same way, because we invented all nations, the same way, what are they going to do for their part is what it was implied. So that other equity stuff, I don't know about that. I'm talking about the greatest crime against humanity and what reparations and restorative justice are going to be taken toward that. Because that will solve that will solve the interaction problem. Because if we're better off socioeconomically, some of us will never see you, you know?
And exactly what I was saying before. So I caught your question, right? But I also translated it into the level in which the institution can. The larger question around equity, reparations, historical, that's beyond their scope. You're now talking on a larger economic, federal, that's a whole other scope. So I took your question and said, okay, if we're going to talk about equity issues on the level that you're talking about, given the nature of this discussion today, we have to convert it in the landscape in which we're dealing with.
And but I want to just respond really quick. As in nature, because we're actually advanced being the inventors of, right? So being advanced, I'm even proposing, because it's not there, we have to bring those ideas for them to implement it just like this. So yes, because you don't do it right now is what you're saying, you all would need to collaborate with each other to solve the problem that you caused, right? So if that's...
So this is where we're back at home. All right, and I want to stop it right there so that we can actually have the people here and actually address the issue. The issue back, and so we didn't go too far. One, you're talking about the various different levels of reparations are in different scopes and there are various different jurisdictions. The jurisdiction that this institution has, right, along race-based data collection, and this is what we're here for today, around equity narratives around race-based data. And how are we going to be using race-based data in a way that fosters equity as a part of the narrative of restoring, right? And one of the biggest things that we need to, I know, but the biggest thing that I believe when I was talking to a few of you prior to the actual meeting, when I was doing my meet and greet, was around trust and data collection. How do we ensure that the data is going to foster equity as opposed to foster more inequity?
That's a lot of ground to cover, but let me just try. So let me start from the data. One of the things that Dr. Fan did was break this up, and this hasn't been done before, in terms of going from what's the prevalence of a racial group in the population to how likely are they to be in an interaction with police as the first part, and in the second part, once you're in an interaction with police, what's the likelihood that you're going to be subject to a use of force? Right? We own, as the police, a certain amount of the first part that I'll call the upstream, like the call to 911, the response, how that happens, that we own. But there's a lot in that upstream that is damage that we are catching, that has happened right back to the times that we're talking about, that has festered, has been a problem in society and in the community, and the police are there to respond. So we're showing up. 92% of the uses of forces originated as 911 calls, right? So we're responding to a lot of pain. And that doesn't mean we don't own how we respond, how we show up, if we show up, who's supposed to show up. Those are all fair questions. It also doesn't mean that the 1.6 times that black people are more subject to force in the downstream isn't something that we own as well. We do. So we're going to own what we own, but also in this data, there's a lot of stuff that we are identifying as let's just call it pain. Okay, and that pain is coming at us as a service. So what's the best that we can do as a service is we can try and bring as much truth to this as we can, and we can work across government agencies, across services, into corrections downstream, into healthcare upstream, to look at how do we solve the problems. So that's our commitment. I spoke earlier about commitment. It's not just, okay, we want to solve the police thing, because this is clearly, yes, there's a police thing, but there's more than a police thing, right? So, and Maya was speaking earlier about how race-based data is being done in a lot of different places. I think what we're trying to do here is really get as much reform out of this data as we possibly can. Sure, get another question.
Sorry.
Hello.
Hello.
Good evening.
Good evening.
I have a question, and it's pertaining to the procedures and workflow. I see something here with the mandatory review of video for all use of force incidents.
Mandatory review, so when there's an incident in the...
Yeah, but, sorry, just use an acronym.
Like going over, I believe, like
yeah, so
body cam footage. So is this just solely regarding use of force, when use of force is?
Okay, so every hour we're producing about 1,000 hours of video, because we've got officers all over the place. They're turning on their cameras, and we also have the in-car camera, right? So there's a camera that points out the front of a car, and so that's also recording events. So let's say you get pulled over, your car is on camera. And so the issue is when and which videos should we review and spend the energy of our managers, the inspectors, the superintendents, the sergeants, the staff sergeants, to look at that and make sure that everything that happened in that video was okay. And so what we're saying is we're going to invest the time of those managers in the organization to review body-worn camera every time we have a use of force. That's what we're saying.
Okay. So this is not in practice yet?
No, it is. We put it in practice. I think we put it in practice 3 months ago. Superintendent, do you remember?
Yeah, correct. It's officially, corporately, it's been in practice for about 3 months. In 42 Division, it's been happening for the last couple of years.
The last couple of years?
Mm-hmm.
Just use of force, though?
So we look at all of our footage. But prior to the implementation of body-worn, we had the in-car camera footage, right? So what we have is our supervisors do a random review of in-car camera footage, right? So that's been happening for a very, very long time, for many, many years, where we'll have supervisors that will do random reviews of the in-car camera footage just to make sure everything's okay, right? Because there could be times where, yeah, there's discipline that needs to be done. There could be other times where we need to educate officers on how they're speaking to people, right? Educate officers on how to use legislation better. Since body cam was brought in, the moment body cam got brought in, we started doing the same thing at 42 Division with the body cam. So that's on top of every single use of force instance being looked at.
And just for clarity on his question, the use of force definition comes into play then? So it's not just any physical interaction, it's by the provincial threshold?
Yeah.
Okay.
Yeah. So I'm kind of reading into your question that you're wondering if it's every use of force. So in this instance, when we talk about use of force, we're talking about the reportable uses of force. So every time a physical force results in a medical attention required, anytime a gun or a taser is used, a baton, pepper spray, any of those kinds of the physical force, open hand.
Handcuffs,
But
falsely arrested.
it doesn't include, so
No?
to your question, it doesn't include use of handcuffs if there's no medical attention. So if there's no treatment from ambulance required or nurse or attendance by a doctor, then that is not a provincially required reportable use of force. So it doesn't meet that threshold. However, we are hearing concerns from, that you're raising and in previous town halls and in other engagements that we've had, that communities want to lower the threshold for the use of force analysis, meaning start to look at, in instances where, there was a scuffle, right? And an officer maybe brings someone down, right? Has to, bring their arms around, and maybe it leads to bruising or a lower level injury.
Okay.
So we
I'm
want
just
to
gonna
start
interject
looking
there,
at that.
I'm going to interject there, okay? The panel has indicated years, for some time now, supervisors, senior officers, they go over footage, body cam, and stuff like that. I had a situation a few years ago myself, not too far from here. I was actually coming from work, from my security job, and not knowing at the time I was being trailed and followed by a marked Toronto police cruiser. And I got home, I got into my driveway, and these police came zooming down my street, came in front of my house, threw me up against my car. I was already out of my car, placed me in handcuffs. I had my phone on. I was recording the whole incident. I was recording the incident, and then they were like, "Why were you running? Why were you?" I was not running. I didn't even know I was being followed. And then, long story short, they didn't know why they were arresting me. They got my vehicle information. They got my driver's license. They got my insurance. And then they actually put me in the back of the cruiser. I'm in handcuffs. My neighbor's seeing all this. People on my street seeing this. I get out my car. They uncuff me, tell me to go about my business, slap me with 5 tickets. Slap me with 5 tickets. Before I go in my house, the male police officer comes to me. He's like, "Can I see your phone?" I'm like, "Why do you need my phone?" He's like, just those videos. Can you delete those videos? Right? I'm like, "No, this is my evidence. This is for my evidence." He's like, "Well, we could confiscate your phone." I'm like, "According to what?" He said, "We could take your phone because it's pertaining to the stop." So listen, I'm tired of complaining. I've been on the front page, Toronto Star. I filed a human rights complaint against the Dermers Police. I've been stopped more than I can count. I've been stopped over 40 times. I stopped counting. And so, anyways, I was just tired. And I had to delete these videos because I was afraid this cop was going to take my phone, and I cannot use my phone. I cannot use my phone to go to work, whatever, just go about my daily business. And long story short, I went to court. These summons had court dates. I went to court. There was no information before the court. My name wasn't on the docket, and that demonstrated there was something was up, that these officers knew what they did was outlandish. It was misconduct. And they had body cam. They had body cam. They had the dash cam. So who's going over that stuff? I'm tired of complaining. Right till this day, these Durham police is fighting me for this case for $10,000. It's merely $10,000. They've been fighting me for 12 years.
So, sorry, this took place in Durham or in?
No, this happened in Toronto. I'm just saying, this is not my first rodeo. That's my point.
Mm-hmm. So if I can suggest, if we can I can speak to you after, and then I will personally look into that matter for you.
That brings up a lot of image. First of all, thank you so much, and I can actually feel the pain that you're going through. That brings up a whole narrative around power and the power around data. So who has the power to say data exists and data doesn't exist, right? And how do we get around that power narrative?
So I'm the Chief Information Officer. So it's me, right? So thanks for putting me on the spot. Yeah. So the truth is that police officers, it is a power position. They have a monopoly on the use of force, and that's their role in society is to use that. And there's going to be abuses of that power. So the information and the integrity of the information is, do we have good measurement? And do we have the feedback loops that situation that we just heard about gets brought to the attention of the people who need to review it, right? I'll tell you, I sit in on the disciplinary hearings, and I hear some of the things that some of our worst officers have done. And it's shameful, some of the things that are done by some of our service members. But I also hear the awards and some of the great things that our officers have done. And there's a real minority that brings shame on us. And so addressing that, identifying those individuals, training it out of the ones we can train out of, and moving the ones that we can't out of the service is definitely something that Command is behind. We might need a few more tools to do that, but I think the conversation here is, how do we create the mechanisms and tools to be able to point to that incident so it makes it to the superintendent without having to have a town hall. And that's where I'd like to bring that change, and frankly, that's why I'm at the service.
I also like to say one more thing along that. You might have something to add as well. As a community, you guys can cover your ears for a second. As a community, we're leaving this gentleman out to dry. We're not going to the municipalities. We're not going to council. We're not using all the political narratives that we should be using to make sure that this gentleman and the children that look like this gentleman are safer. If the community doesn't mobilize politically, because that's where power is, we're leaving our community out to dry. And we're also leaving the good police officers out to dry because they don't get the support that they need. Right? So we need to actually, I kind of put out the question around power dynamics, but the fact of the matter is we have to mobilize. Right? We have to mobilize by making partnerships and figuring out what the storylines really mean. What does race really mean? Is it a perception document or is it a race document? What does it really mean? What policies that were enacted after this actually were effective and which ones weren't? And if we don't like the threshold that the province is putting forward, we can't come to these guys. We need to go back to the province and say, hey, what are you doing? Right? And that's how we make this gentleman much more safer. We can't say voting doesn't matter, I can't business, I can't bother with that. Because this is a result of that narrative. So I just wanted to put that out there, that when we talk about power, we're also talking about politics.
I've lived in Malvern for about 40 years now.
You want to take the mic? Okay.
And I've seen a lot of things in here that I like and I dislike. This summer, we had a collaboration with 42 Division in a certain school, and they came on board to help with the kids planting flowers and being around with them. They had a fun day, they were there. Why can't they come in their ordinary clothes and get the trust that kids want, that
we need to humanize both sides of it. Is there some legal thing around the uniform?
It's a difficult situation for us, really. Yeah, so what got asked is, you know, for example, like after-school programs or interactions at schools, why can't the officers just come in their plain clothes? And part of the predicament that we get placed in is that we have a finite amount of resources. There's only so many police officers working in the city at any given time. And unfortunately, we need to be ready to respond to any kind of crisis, any place across the city, and sometimes at even jurisdictions to help them out. So if we put our officers in a situation where they're not prepared, then we're not able to react and support the people that need our help right away. We love to come out and interact with kids and, you know, be in situations with people where there's not a crisis. And we can just chat and, you know, share stories and get to know each other. But unfortunately, it's a big city with big city problems. And we need to be able to jump in our cars and leave, unfortunately, sometimes and go, you know, either support other officers or respond to an emergency or a crisis. So we would love to, but again, like I said, there's only a certain amount of us working at any given time in the city, and we need to be able to, you know, stop what we're doing and react sometimes.
Yeah. Here, you have, as a visible minority, you have, like, say for instance, my son, and 3 of his friends go out with his dad's car, a new car, and they're being trailed for about an hour, and then someone, get out of your car. Why are you telling me to get out of my car? Is this car yours? No, it's my dad's. I want to see the ownership. I want to see all the papers. First, come in and tell him, you can go vote yourself. I'll vote your own. Why? And then he has friends in hockey that have a brand new car, 16 years old, driving around with his friends. Not a thing happening to him. It's wrong. It is wrong. And you get people with mental illness. When you treat others with respect of all colors and all races and classes, you're going to get that respect. And think about the young kids in this area who has a single parent or 2 parents, but struggling in a factory or some job. They don't get enough food, they don't get enough hours of sleep, and they're trying to live. They can't even find a job because of where they live or who they are. And then some little thing happened, a little tiny thread is broken, and then they flare. In the summer, I met an Italian guy. He was asking me about the volunteers we have in our school. We have beautiful ladies and men that volunteer in our school at Sterling. And he said to me, you know, I'm Italian, and we had a great family, but I did a lot of things when I was a teenager that was foolish when I look back. So these kids are no different than me. So you gotta not think about the things they did, but see if you can tell them, nurture them, help them to come away from where they are at right now and move on. We all make mistakes. You didn't make a mistake? You didn't make a mistake? Sure, but you have parents that encourage you, tell you it was wrong, move you up. That's what we need to do in all communities, not just Malvern, not just Jane and Finch, not just wherever you are. You just need to respect and nurture these kids. We're going to be older very soon. We need these kids.
I want to say thank you, first of all, for bringing all of that up. I think it's crucially important for how we move forward.
Explain a little bit about what was asked too, because
Okay, yes, that's right. Just, yeah, sorry. Thanks, Roseanne. For the people at home, just, it's a conversation about familiarity.
Well, and people having a story, right?
Yeah, that's right. And today's a good example, right? So we're talking about data that, you know, we've analyzed and we've poured over. And that data points us into a direction, but it doesn't tell us how people felt. It doesn't tell us the emotions that people are feeling. It doesn't tell us the need for familiarity with our neighborhoods, right? And going back to what Mike said in your earlier comment about, you know, officers being involved in the schools. We have a phenomenal neighborhood officer program. And again, I would bet that if the neighborhood officers from 42 Division stood up, people know their names, right? People know Jeff, Ramesh, they know their names. And to me, that is the step beyond the uniform, right? We are embedding in everything we do familiarity and mutual respect. Those are two things that I personally think that we need to really, really ramp up on. And quite frankly, I also believe that we put so much stock and effort into our neighborhood officer program, and I think it's absolutely crucial that we do that. But in 42 Division, that's Malvern and that's Chester Lee. What about all of the other neighborhoods, right? Like, truthfully, what about all the other neighborhoods? You know, I think that there's a way to get beyond that. We've done a lot of work to change the way that we deploy our officers so that we're not only being reactive. If the community only sees us in an enforcement capacity, we lose, quite frankly, right? What are we doing in order to be proactive, right? So that we're making a difference in people's lives when 911 hasn't been called, right? What are we doing in terms of getting out there and engaging with people, right? In a proactive way, so that, you know, when you see a car driving down the road, it's not just a car driving down the road. I recognize that car, right? When you see somebody, a group of kids walking down the road or in a park, you know them, right? I years ago, when we were building our focus tables, I had a sit down with the Ministry of Corrections with a bunch of youth, and I went out of uniform. I went in my plain clothes, and we were having a good conversation. The moment they found I was a police officer, everything, right? Everything got like, hey, we're not talking to this guy anymore. But I asked them straight up. I said, if you were all of you folks, you're on a corner, and if you see me coming up to you in my uniform, what would you do? And the first thing they said was, we would run. I said, well, why? Right? And they said, well, because we don't know. We don't trust you. Like, we don't know what you're going to do. At the end of the session, at the end of the day, I asked them the same question. I said, okay, now, if you see me coming up to you, would you run? No. Why? Because we know you now. Right? Like, that's light bulb moment stuff, right? Like, another good example is, a year and a half ago, we had a shooting in one of our neighborhoods up in Chester Lee. The very next day, we were in the neighborhood knocking on people's doors with the Toronto Community Crisis Program folks. And we took officers. We took primary response officers with us. And I was blown away because after that was done, one of the officers that I had with me was a very new officer, chatting with him, well, what did you think of that? And his response was, well, they really like us here. I was like, what? Right? And that's a failing on leadership, quite frankly, right? We need to do better in terms of getting our officers involved in proactive ways, not only in a reactive state, quite frankly. And we're doing that, right? We are actively deploying our officers in Scarborough in a different way. Because I'd like to get to the point where it's not only MZ and ACE that are out there, right? The Melinda Mantles of the world, that you can see a car driving by and say, oh, that's Watsy. Oh, that's Mike. That's Rich. I think we can get there, right? But we can't get there alone because, again, it's called community safety. It's not police safety. We cannot do this on our own, right? TCCS from Taibu, that's a great example of a program that is amazing. It's creating time so that we can come out to do those things, right? By creating the Toronto Community Crisis Services. So I know that was a very long answer to your question, and I apologize for monopolizing all the time. And we have another question up here.
Hi, everyone. I have two questions. Thank you for speaking today in your town hall. So earlier, the Chief Information Officer, I think you said something that really resonated with me, that your priority is finding a good measurement and an accurate measurement and developing good feedback systems to solve, the inequity in our systems. And when I think about the Toronto Police, when I think about the police and a lot of issues that have happened in the past, I think back to over-policing in terms of that maybe police officers might be in a particular area even more than the others. So as you're gathering like your race-based data strategy and deploying your officers, like how are you going to be able to overcome like areas that are more over-policed? Because that's going to lead to like a challenge in your data collection.
So outside of the race-based data analysis, we did a big study of response times. Response times were pretty bad across the city. They were particularly bad in areas that were underserved by just generally underserved, challenged neighborhoods. But they tended to be so because those neighborhoods had higher demand. And then when that higher demand happened, we just couldn't flex the service enough to get the resources to those neighborhoods. But response times are generally bad across the board. And this comes to not having enough officers, and that's the challenge. Now, not having enough officers is partially a model question, like this is the way we do policing, so if we did it differently, how many would we need? And so a lot of the technology investments I'm trying to look at are in trying to have more productivity out of every officer, and that's a challenge as well. But I think the term over-policing is really a question of community perspective, right? So if you don't like the policing, it's over-policing. If you like the policing, then it's under-policing or it's adequate policing, right? And I think what WotC's trying to do here is make the policing a really positive experience, a community-engaged experience, and building those relationships with the community. So if you're at the street corner, you see a cop coming and you got to run, well, that's over-policing. If you are at a street corner, you see a cop coming and you're like, hey, it's WotC, then that's not over-policing, right? So it's a question of changing that dynamic and that conversation rather than so much how many more officers do we need in which neighborhoods. Once you get into that conversation, it's a totally different, it's a different conversation.
Just to jump on that one as well, can those two things over and under exist simultaneously?
Yeah.
So for example, you may be over-policed while you're driving, let's just make up a scenario. But then you can ask the same community, are there, how many cases are solved around Black women being raped, right? So there's narratives around under and over. In some cases, the inequality isn't always landing in over-policing. It can land in under-policing, right? So I just want to make that clarity as well.
And it could also be a situation of not necessarily over-policing, but over-enforcement, right? Because again, there's been such a change in the approach to policing to say that if you have a problem, the answer isn't numbers driven, right? So if there's an issue with crime, the answer isn't arrest everybody, right? The answer isn't give everybody tickets. We've proven now that is ridiculous, right? So I think there's a difference there in terms of like is it over enforcement?
Yeah.
Or is it like the deputy says, or is it a situation where there's just a lot of visibility, which might not actually be a bad thing.
Yeah, sorry. I think the term was like I was referring to was over-enforcement. And
right.
Earlier you kind of mentioned this point about how you were looking to proactively enforce like people in like proactively. Mm-hmm. And so even between people from different races, like for example, when it comes to certain like Black communities, even though we all like might share same race, when it comes to like a particular population, it might also come down to like socioeconomic class. And certain areas, we know that an experience for a middle class like Black person might be different than one in a different area, like a lower income place. So does the deployment sort of take that into consideration under the current system you have in place? Or
So I would say currently the way that we're trying to change our deployment model is to focus on neighborhoods, period. All neighborhoods, right? Regardless of the socioeconomic status of a neighborhood, right? I think all neighborhoods deserve visibility and they deserve to have a relationship with the police. I think what we do to kind of answer that is we've developed really good relationships with our local businesses. We've developed phenomenal relationships with all levels of government. Right, we have our 2 local councils here tonight. These are individuals from the community, from our neighborhoods, and I think that's where we can have those meaningful conversations to say, listen, this is what we're seeing from a policing lens. Here's how you can help us. Something you wouldn't even think of, like the zoo, right? The Toronto Zoo is in 42 Division. We've got a phenomenal relationship with them because that's an opportunity to give opportunity to people, right? And the Scarborough Business Association, that's another great example of, if we are dealing with situations, families where, individuals need help, well, now we have those relationships where we can say, actually, here's an outlet, here's an opportunity that we can provide for someone that's not enforcement related, right? And I think that's where we need to get to. We need to get to the point where the police are part of the community and we're seen as a partner, right? Because rather than only seen as, okay, something bad is happening, it's got to be the police, right? Because I think that's where historically we've always gone to, right? We've always relied on the police to enforce. What we need to do is we need to rely on the police to partner.
And I'd also caution, with that question, or what you were alluding to, came up in the JCA.
Oh.
And it was, no. I like the fact that you brought this up because we should, there might be an assumption that you're connecting race and class, right, with what you just said around social, right, political narratives, right? Some of the neighborhoods that you thought the overstopping would have happened didn't happen in those neighborhoods. So making the idea that you're connecting race and class narratives around who gets stops based on race or perception of race, that's also an assumption right now. So the data doesn't say anything about that right now, so let's not make that leap. And that will be something that we would have to, I guess, dig into a little later. I have
a third question. Sorry.
Okay.
Sorry, guys, I'm so sorry. Okay, so a lot of the conversation I'm noticing here has been like around the use of force, right? But a lot of the times, being stopped by the police and even a criminal infraction that's like on your record can be almost just as damaging. It can make it a lot harder to find a job, to find a steady income, and things like that. And in the past, what they've noticed is that people who end up being stopped for traffic infractions, and then slowly it involves like searching the car or something more, and it is then sort of escalated into a drug charge or something like that, right? So when you're collecting evidence, right, I'm seeing like the board, it says, in what types of situations do we see overrepresentation in use of force and what they were specifically responding to? So are we saying that they're responding to the drug charge that they ultimately ended with, or like the traffic stop?
So, yeah,
Oh,
I can clarify. No, don't apologize. Those are good questions. So I can clarify. So what we looked at was, we looked at all the incidents in which an officer had an interaction with a person in an enforcement capacity. So it could have led to a ticket, it could have been an arrest, it could be just the person was identified as a subject or a suspect in an incident. And so we broke it down into call for service type. Right? So what was the nature of the 911 call that the officer was responding to? So that was one lens we looked at. And then the other lens we looked at is that when an officer arrives on the scene, what was the nature of the incident that the officer describes, once they've investigated and they have more information. Because a 911 call could be a suspicious person, right? Person comes to the scene and it turns out to be a domestic. Right, and so we looked at that bucket as well, and it doesn't have to lead to a charge. It doesn't have to lead to an arrest, but it can. It could just be, an incident an officer responded to and created a record in our system. So we looked at all of that, right? And in all of those situations, how many resulted in a use of force? And how many, and what race what was the person's perceived race by the officer? And then we looked at the broad trends. Was there a pattern? Because we're really looking at, trying to find a signal in the noise, right? Every situation is unique. Every individual is unique. Every officer is unique. There's going to be a lot of factors at play. But by trying to compare apples to apples and seeing if there's a signal and a pattern that we can identify differences by race, it gets us a little bit closer to, okay, do we need to understand if implicit biases are at play? Are there something about our procedures or our policies that's leading to different outcomes for different people, right? And so that's what we attempted to do. And I think, where you were kind of going along the line of, is it enough to just look at use of force? You're right, it's not enough. We started there because it was a priority area to understand, but for phase 2, the next phase of the strategy, we're going to expand it. We're going to look at what are arrest situations, what are our decisions to release at scene or bring a person into custody? Are there patterns and differences by race in how we, make those decisions? What are our youth diversion programs? How are we using that? And are we using that in a way that's racially equitable, right? And so that all youth, to this, lady's point, all youth are given the benefit of the doubt and the opportunity to write their path, right? Rather than being channeled into the criminal justice system. We want to look at mental health apprehensions. How are officers using Section 17, which gives officers the discretion to, rather than arrest the person, take them to hospital for treatment, right? For violent behaviors, let's say, right? So those are the things that we're hoping to use the data to help us understand a little bit more. It's not going to help answer all of our questions, but conversations like this and continuing engagement and involvement with the community advisory panel, with our officers, we can at least get closer to an answer and closer to a picture that we can work with our sector partners. The question earlier about how are we working across all of society, because this is an all of us problem. It's not just a policing problem. We need to involve school boards, children's aid societies. We need to figure this out together. Right? And policing has a part, but we're not the only part. But we need data to help connect the dots and help bring people to the table, because right now we're not coming to the table together.
I have a question around connecting the dots. I once spoke to someone who's a lead at U of T's criminology, and he was talking about mental illness. And he was saying that through many countries, they're finding that Black men are being identified as for treatment or getting treatment very late, right? Do you find that the data is suggesting that no, you have no?
So we wouldn't be able to do that with our data.
Right.
Cops aren't mental health practitioners, and so you can see symptoms, but we shouldn't try to make cops into clinicians. The primary role is to bring a situation under control and get someone to the help that they might need. And they're probably going to get that wrong in some of the cases. To see behavior that's mental health driven to be violent behavior, criminal behavior, and vice versa. Designing in the checks on that is part of the issue. And we've made great strides in reducing the violence of encounters with people with mental health issues. Numbers are really positive in that trend. We're also working with mental health persons in crisis. We've added a crisis intervention to the 911 call, so some 911 calls get diverted to a mental health practitioner right away, and that's a new innovation. So there's a lot of work there that's being done, but we don't have the data to bring together the health side and the policing side.
Okay. I only asked that question to see how you were working with your community partners in that gap. So you went through that. We have another online?
We do. We have another online, and then I think there's two more questions behind me because I know we're running short on time. So I'll summarize this question as quickly as I can. It's about community policing and the neighborhood community officers. So how long do they remain in their role? And are there a required minimum amount of community hours? And then maybe a bit about the officers who are selected for that type of role. Thank you.
Yeah, thank you for that question. So we have a dedicated neighborhood officer program, the neighborhood community officer program. In 42 Division, we have Malvern and we have the Chester Lee neighborhoods, which includes also Empringham. We have dedicated time, so officers are deployed to those neighborhoods for 5 years, and they stay in that neighborhood for 5 years at a time. We do a lot of work in terms of like sustainability, right? Because officers do also want to explore their own careers, right? We find that a lot of officers will get promoted and leave the neighborhood officer program, so we do a lot of work. Again, I introduced Ryan Ford, who's a neighborhood staff sergeant in the back, and Neil and Rich. We work with them pretty much on a daily basis to kind of like identify the next people, right? So we know that we've got Jeff Ems and Ramesh Prasad, who are dedicated neighborhood officers, but what happens when they go, right? We try to make it so that it's not like, okay, on a Monday, Jeff is gone, and on the Monday, Mike starts, because that would make no sense, right? So we try to kind of like look at, say, okay, if we're gonna have some changeover in that office, how do we do it so that we can best share that knowledge that these officers have, because they have a ton of knowledge. And more so, it's just that familiarity in the community contacts, right? It's absolutely crucial. How we select the neighborhood officers, we have these conversations on a regular basis in terms of officers who we know have, you know, a little bit maybe more emotionally intelligent ways to deal with things, right? Who have relationships, but also we've done a lot of work in 42 to like bring people into the division that, quite frankly, have, you know, Scarborough love, right? You know, Ryan grew up here. I grew up here. Like a lot of the officers that we have grew up in Scarborough, right? So we take that into consideration as well. And I think so far we have been very successful. But again, outside of the neighborhood officer program, we have also changed our primary response model, and we have dedicated and embedded officers into neighborhoods permanently for a year at a time. So a good example, if Mike and I are, we start our shift at 6 a.m., the old model would be we start our shift at 6 a.m. and if we're partners, we'll get into a car and we'll just respond to radio calls, right? But where's our focus, right? Where's our focus? So what we've done is we've identified all of our neighborhoods in Scarborough, North Scarborough and 42, and every platoon has dedicated their officers to neighborhoods. So now we start at 6 a.m. We're the Malvern, we're always in Malvern. When we're not on a call, guess what? We're in Malvern, right? Again, it's a way for us to kind of like look at increasing familiarity and accountability and ownership, right? It's a way for us to say to our officers, we need you to engage in a proactive way, right? We need you to take ownership and have the accountability to engage in a proactive way. And I can't stress that enough.
So just going to add a 2 cents.
So the question was, do we find that like in 42 Division, we have officers that represent the people we serve? And I would say yes, right? I would say yes. I can't, so we had Junior Carnival, right? Just in the back, right? And what a great day that was. I walked around with Ryan, and he was a celebrity, this guy, right? Yeah, exactly. Yeah. But you couldn't go 5 feet without Ryan recognizing someone.
Same thing, I came with him to Thai booth.
Right.
He's giving out hugs everywhere.
But that's an important piece. So I actually fundamentally do believe that, and Jack Crilly, same thing, grew up in Malvern, right? And he's running all of our criminal investigations. I personally think it's an important piece. I'm a Scarborough guy. Mike and I were in the same recruit class together, and we both started in Scarborough, right? So I think that when you have a deep-seated kind of like connection with a place, I think it makes a difference. Mm-hmm.
I just want to bring a command perspective on this. We had to make some hard choices, and we chose to give up on another program so that we could reinforce and build up the neighborhood community officer program, and a lot of faith and belief in that. And then we were thinking, like, why are we putting the NCOs on a pedestal? Like, this should be the way we do everything. And this a program that Superintendent Watts has put together here, born in Scarborough, Scarborough Pride, whatever you do to that, it is spreading through the whole city. And it's a push towards more community policing, more engagement, more of that familiarity. And there's innovation that's happening around this. The other thing I'll say is we were looking at the question of how fast people are getting rotated, because that was a big issue that was brought forward at the Jamaican Canadian Association last week. So we're in the middle of pulling all our data and seeing how often are we flipping people in the NCO program, and that's going to be a conversation at command next week. So I want you to know that you're being heard. We're taking the feedback seriously, and it's coming into command in conversations with the chief and the other deputies, specifically in this case, Deputy Pogue.
So we have one more question. We got two more questions, and then we're going to break out.
So 1, 2, 3.
So good evening, folks. My name is Zane Kurm. I've been a lifelong resident of the Malvern area. So in regards to this gentleman's experience with the police officer, I don't know too much about law, but it seems apparent that there was some sort of racial intent there, you know, with the discrimination. And so I would ask the table, wouldn't you agree that when it comes to prejudice and racism, it's based off our opinions and biases? So there's a simple yes or no, yes, right? So now there's two types of biases, right? There's the conscious bias, and there's also the unconscious bias. And unconscious bias we experience on a day-to-day basis. You know, we're human, and that's only natural. And so when you were presenting the Driving Change poster board, you spoke about training. You mentioned you'd be, you know, doing training and whatnot, but you didn't go into detail about the different types. I might have missed this, but you know, you spoke of the buddy program with the senior cop and the junior cop and the sort of understanding childhood trauma and whatnot, but I didn't really see too much emphasis or, you know, details about, you know, training implicit, unconscious, conscious bias. So my question is exactly that. Are there any means or any sort of initiatives going on to sort of train police officers to identify when they might be looking at biases in the work field?
I'm going to say probably about 5 years ago in our annual training, implicit bias was brought up, and it may be even longer than that, but I certainly remember being in the classroom, and it's been a conversation ever since. So we actually train our officers on, and it's just like this exercise. It's like an exercise in self-reflection, and asking yourself, like, when you pulled that car over, were there reasons other than X, Y, Z? Was there anything else that kind of, you know, pushed you to look further or look deeper, and ask yourself why? So that conversation has been going on, and embedded in our training scenarios that we do with our officers, and a lot of the mandatory training we have for them online as well, that they can do on their own time and learn about those things and self-reflect. We also actually train, and it came up a little bit earlier, the doctor was talking about, you know, types of calls for service and then outcomes, and we actually teach them about, you know, if a caller, for example, sees a person they believe is suspicious, it's like, what is it they see about a person that's suspicious? Do not let someone else's bias be imposed on you and affect your actions. So we have been having those conversations and training and helping our officers kind of, you know, have that self-reflection, and also recognizing that someone else could impact the way you respond to something, and being mindful of that while you're driving on the way there, that the person that's calling may have a racial bias, or may perceive something that you see completely different once you get there, and be aware of those things. So it's certainly some vast improvements that we've been making in the last few years with our training with our officers to recognize that any bias that they house never comes out in their duties, and also recognizing that not allowing someone else to influence the way you respond to other things as well.
And in addition to that, all supervisors have been trained in the intercultural, in the IDI, the Intercultural Development Inventory.
Okay.
Which is about identifying implicit bias.
Sounds good. I know I'm not asking, to eradicate bias altogether. It's just important that we identify it, and it seems like there's been major strides in identifying bias, but still I think that needs to be further improved on. But thank you.
Yeah.
Yeah, thank you for that. And I just want to point out, in the breakout exercise that we're going to go into soon, there's a table on training. So I welcome your, involvement in that table, because there are actually college representatives here, and they can tell you about all the things that they've been doing around training, around understanding systemic racism, anti-Black racism, and all of that stuff.
And I just have a quick question, and I know that this is in the back of your head, or I think it is. How do you know the training is working?
So I used to be in healthcare, and funny stat was that 90% of physicians think they're in the top 50%. It's a slow one, right? But most people don't know they have biases, right? So this is what I'm talking about in terms of feedback loops, and creating the feedback from the community to be able to identify that that guy has got a blind spot, and needs to have a conversation, because most of us do, right? They're implicit because we don't see them, and so that's part of the challenge. So recognizing that, and the other thing we've heard a lot in the community engagement is you can't train this stuff out, right? It's not a training issue as much as it's an experience, it's a bias, it's what's happening and how people react. So we've got to go a little deeper than just training, and I as a measurement guy, I believe in feedback loops, but I think there's other things that we can creatively come up with together on how do we help people. And I would say help people because this is about calling people in, not calling people out, right? And some of the stuff that we need to do is subtle. It's changing people's minds. It's getting them to behave in a different way. And so that's again commitment to getting there is what we're about. So just for those on the call, the issue is the question, the statement I guess is that emotional intelligence is super important and a part of this. So how do we select? How do we train for that? And how do we measure it? So there's sort of levels of training measurement. The lowest level is did they show up? Tick. Then you get like did they fill out the questionnaire at the end of the training correctly? Tick. So part of the challenge I have is setting up measurement systems that go into the actual performance of the work and then create the signal to say, no, you may have taken the training but didn't get it, or doesn't have these skills or competencies. That's a big lift of work, but that's what comes to me.
And I also think, just to kind of like piggyback on that, we are very big on engaged and visible leadership. right? Because again, soft skills, there's a lot that go into that, right? It's about having our supervisors very much engaged with their members, very much involved, like understanding what's happening in an officer's day, not only with what they're responding to, but how what they're responding to could be affected by what's going on in their personal life, as an example, right? All of that is important. So, if we tell our supervisors all the time, understand who your people are, know who your people are, understand that, if they're having something going on at home, a bad day, how is that affecting them when they're here, right? And I think that really comes down to heavily engaged and visible leadership.
Well, and just to touch on another point for something that you brought up is we've made I think of some vast strides. I started back in 1999 with the superintendent. When we started, we celebrated, for example, like a great arrest, like someone took a gun off the street, and that's what we would celebrate. And what we're transitioning to is celebrating soft skills. So it's tough to measure those things. It's like trying to measure the shooting we prevented. No one knows it didn't happen, except for maybe the people that were going to maybe try and go do it, and we happened to be in the right neighborhood, and they turned around and left. So it's tough to measure those things, but what gets measured is what gets done. And when the people in charge are celebrating, a great de-escalation, no one got hurt. Maybe somebody goes to the hospital and gets mental health treatment, and no officers get hurt, no public get hurt, the person apprehended doesn't get hurt. And when we got there, it was an emergency. That's the kind of things that we're trying to recognize and talk about every morning, and with our officers on parade, and celebrate those things with them and show that that's what everybody wants.
And that's where the body cams are also great. Right? Like the body camera footage for us, it's not only about identifying situations where we need to, enact the discipline process. It's also situations where we can celebrate, right? Like, so when you look at a body cam footage of like Neil doing something great, even just having a nice conversation with someone, right? It's important for us to get that out there, right? And celebrate that, share that with our other officers.
Thanks. I had a question. I just wanted to make sure that I can get it out. Thank you for coming out and sharing this information in a digestible manner. I just had a question regarding the system implementation. I know you showed a stage gate process of the whole process, as well as the data that's being collected and an agile network over there. Has this type of system with this diverse parameters being implemented anywhere else? So just to have some sort of something to measure against?
So in other words, what are other police services doing? Is that what you're asking? Our approach, has it been done elsewhere?
Yes, but I do understand the complexity of the data that you're collecting. It's vast variety. May not be comparable in other jurisdictions. So my question is, has there been another jurisdiction, as you said, that has done something comparable with, no, right?
Yeah, so thanks for this opportunity to say how much Toronto Police Service has really advanced the conversation with our approach. And I say that humbly, but also very proudly. We've taken strides and made efforts to go beyond what other jurisdictions have done by really digging deep and using more of our data than any other service has so far to date. So I mentioned that in the province, all police services have to fill out and use this provincial form, right, in use of force situations that require reporting. So all police services are doing that, but they only collect data in the use of force form. What we did was we included perceived race data in all of our interactions where a record is created. And so that helped us to really understand the situations where we used force, but also situations where force didn't happen, right? And then that allowed us to really dig into, okay, what are the scenarios where we were more likely to use force involving what types of people, by race, and identify where there are disparities, right? Differences in outcomes that were being experienced. And so that gave us a much richer, more nuanced picture, and helped us to identify those areas. And one of the things that we've been doing is having conversations with the province to help bring other police services along and lift the way we all collect data and can analyze in a similar way, because we need consistency across other police services in the province so that we can see, is Toronto doing better or worse than another police service? What can we learn from each other? Who's doing things well, and how can we replicate that elsewhere? So I think that's an important question, and that's something we're working on.
So I just also want to shout out to Nate. You standing up there, because the other thing that was really unique about the process was having 12 people holding us accountable and asking tough questions every couple weeks, and be like, TikTok, where's the data? So that was uncomfortable as a process, I'll say. As a guy who doesn't usually operate in race-based data and space, and also relatively new to policing, to be in that conversation and to being held to account by a bunch of community members who are really good on data, really strong analytic skills there too. So that was unique about our process vis-a-vis any other police services. And I think sitting in that discomfort, as we describe it, is a part of what we need to do, and it's part of how we move the conversation forward. So it's not the last uncomfortable conversation I'm going to have, I'm sure, and we're going to have the analysis of arrest, apprehensions, and diversion data next, and I'm sure there's going to be some uncomfortable stuff that's talked about there, and we're going to look at the next thing and the next thing and the next thing. And that is relatively unusual.
Okay. My name's Debbie. I just wanted to know, how is data affecting the homeless people? What are you guys doing about that?
Yeah, thank you. So I really appreciate that question. So identifying the homeless population in the data is tricky, and that's one of the areas that I've started talking with our team about, is starting to pull in residents' information. So there are certain indicators in our data that we could potentially use, but it's not perfect, right? Because the person's resident could be the shelter, right? Or address unknown, right? And so how do we identify homelessness? How do we use that data to really, understand the experiences of the homeless population, and policing, I think is really an important question that we'll keep on top of our minds as we, expand and improve our methods.
Okay.
So thank you so much.
So Roseanne, you might have to help me out here. So we're going to.
So the formal process of the town hall, we wanted to bring to a close because we are live streaming. We also did promise people until about 8:30, but you'll see that we also have tables and some of the themes of the breakouts. So I'm going to ask you, since I did get you some amazing food and there's still some food remaining, that you just stay a little bit longer in person here, and we just want to hear just some feedback, and we'll have some facilitators at the tables just to kind of bring it to a bit of a close, and then just take some notes, if we can ask the generosity of spirit around that. But I still want to have a closing remarks from our the panel as well as our community partners, and then we'll just turn yourself around to the table that you're already sitting. If you're not sitting at a table, you can join a table, and then we'll just get some of those feedbacks, and then we'll just slowly move out of here by 9 o'clock. You don't have to go home, but you need to leave.
So I know where you go, but you gotta stay here. So Roseanne, you want us to do closing, and then they can spend all the time that they want?
All they want.
Okay, the floor is yours, Colin.
Okay, just because I'm getting in the way of more feedback, which is what we're really into. It's just a thank you. Thank you for showing up. Thank you for being here. Thank you for candor and for giving us your honest feedback. Again, just to stress, the command is committed to moving the ball, to taking ownership and not being pushed. And we want you to feel safe. We want you to feel safe in your homes, and we want you to feel safe interacting with the police. And that's where we're trying to get us all to. And hopefully you feel that in the room. You feel that with us being here. And hopefully you feel it tomorrow when you see Watts in the street corner and you wave hi to him.
Don't run.
Don't run. Thank you all.
Oh, wait a minute.
I just want to thank everyone for coming and participating in this important but also challenging conversation. This is certainly the beginning for us to start discussing these important issues. And in fact, it is beneficial, it is required, it is necessary for all of us. And I would like also to make a reminder for our youth focus town hall. That's going to be like MFRC, Malvern Family Resource Center, is going to host the town hall on next Tuesday, November 29th. So just trying to engage more youth in this process and to hear from them as well. So thank you everyone, and have a good night. All right. Thank you.
If I can, just in closing, I also just wanted to say thank you on behalf of 42 Division. Thank you, Taibu, Malvern family. Thank you for your partnership that happens on a daily basis. I also want to say thank you to the officers in 42 Division. We have a phenomenal group of men and women that I'm extremely proud of, and I want to say thank you to them as well. Mike and I, our doors are truly open. They truly are. If anybody wants to have a conversation about anything, please come and see us. Please come and see us.
Thank you. So just a reminder, you can just turn around, join a table. There's some questions on the large foam core that you could actually just answer.
Thank you.